Thanks for tuning in to the Drive On podcast, where we are focused on giving hope and strength to the entire military community. Whether you're a veteran, active duty, guard, reserve, or a family member, this podcast will share inspirational stories and resources that are useful to you. I'm your host, Scott DeLucio, and now let's get on with the show. Hey everybody, welcome back to the Drive On podcast. Today, my guest is Brian Noonan, and Brian is here to discuss the Sinclair Method and how it works to help those who are seeking help dealing with problematic drinking. So welcome to the show, Brian. I'm really glad to have you here.
Yeah. Thanks, Scott. Thanks for having me on. And we're going to talk about the Sinclair Method and how to drink less.
Yeah, absolutely. So for the listeners out there who may not be familiar with you, just could you give us a little background on who you are and what you do?
Well, I am a psychiatric nurse practitioner, which means actually different things in different states. I think most states now, it means that you're capable of independent practice, including prescribing privileges. And in other states, they function more kind of like a physician assistant or something like that, where there is some type of collaboration with a physician in terms of diagnosing, in terms of medications. I'm licensed in about 15 states. All of the states that I'm licensed in, I am practicing independently. So I provide general psychiatric services to adults. So usually that is depression, anxiety, ADHD, sleep problems, those types of things. So that was kind of the foundation of my practice after graduating from Vanderbilt University in 2007. About 5 or 6 years ago, I started practicing. I became aware of the Sinclair Method for alcohol use disorders. And it was so impressive to me and so remarkable that it didn't take very long to realize that this was really kind of a completely different way to think about the problem of drinking. And basically, very quickly, it became the focus of my practice. And in fact, kind of really formed the basis of health, which is really, of course, it's common now because of the pandemic. But back in 2017, 18, you really had to explain to people what it was. And there were kind of even concerns about having healthcare delivered by video. But what kind of prompted it was I was based in Seattle, and kind of, I guess, through word of mouth and so forth, that people started actually driving up from Portland or from Spokane or from other places around the country, and we were having inquiries from other places. And so that kind of prompted the idea that, I should have a license in Oregon and do telehealth so people don't have to drive here. And then it was, Idaho and Colorado and Arizona and most states out west. And since that time, I've seen thousands of people. I started the company, sinclairmethod.org, and we have a team of providers now. We serve about 80% of the United States, and it's kind of every day we're just kind of more and more convinced of kind of truly the amazing results with this medication to treat alcohol use disorders. And it's a completely different way to think about it versus something like Alcoholics Anonymous or something like that.
It really is amazing how far we've come since the 2017, 2018 time period that this started, where you're saying people were still kind of hesitant with the telehealth and all that kind of stuff. But the pandemic really accelerated how quickly we accepted telehealth. Having a meeting over Zoom with somebody, you're on one side of the country, you got somebody else on the other side of the country, and you just sit down and you meet with them over Zoom or something along those lines. It really accelerated all of that stuff. And it's pretty amazing to me how 2017 almost feels like the Stone Ages with, how far back that was, as far as our thinking of, these types of things. But why don't you describe what the Sinclair Method is and how that works?
Yeah, well, it's an interesting history to it. Actually, the medication itself that's involved with the Sinclair Method is called Naltrexone, N as in Nancy, Trexone, so Naltrexone. And it was FDA approved for alcohol dependence in 1994. So it's quite an old medication. It's generic now, and it's quite inexpensive. maybe it's about $1 a pill or something like that if you're paying out of pocket. Most insurance companies will actually pay for it. But what's interesting about it is that it was the way the Sinclair method uses the medication is not in the manner in which it was FDA approved, which makes it, which is what makes it interesting about it. Because the medication itself, what we subsequently learned is that the method by which, or the approach that the FDA, that granted it FDA approval, turned out to be not very effective. And in fact, the largest study using naltrexone in the way that the FDA recommended was negative. It turned out that it did not help. And so the FDA recommendation was kind of based on a kind of a traditional way of thinking about the problem. They would prescribe the medication and they would advise the patient to not drink alcohol, which kind of, if you're coming from a traditional framework, that makes sense. So the patient takes the medication like they would any other prescription medication. And essentially they would go as long as they could without, and in fact, the early instructions required patients to have not had alcohol for 7 days leading up to the initiation of the prescription. And so this turned out to be not really effective treatment. But one of the interesting things that they found about and all the negative kind of subsequent negative studies for it was that the people who did not follow the instructions, the people who did drink, what you saw was something different about their behavior versus the people who did follow the instructions. And what you saw is that when they would binge or when they would drink again, there would be some type of limit on it. In other words, the size of the binge drinking or the size of the relapse or the size of these types of things were reduced in the people who combined the tablet with the alcohol use. And this was kind of in concert, this kind of information was developing, and it was kind of in concert with the namesake of the approach, Dr. Sinclair, who originally was doing studies with rodents, like mice and rats and things like that, and essentially creating mice who were alcohol dependent, kind of alcoholic mice, and kind of seeing and giving them naltrexone and seeing all these types of things. And so he developed a lot of his early theories based on this, kind of seeing how naltrexone would work. And what he found was that only the mice the only way to kind of extinguish the interest in drinking was to combine the tablet with the alcohol. So that kind of over time developed into kind of the Sinclair method, which is to combine the prescription medication with alcohol. You must be drinking in order for it to work, which is sort of a shocking kind of thing, depending on how your understanding of alcohol treatment goes. The way it works is the medication blocks the buzz, essentially. The medication is a buzz blocker. It was kind of a shorthand way of thinking about it. What we don't really appreciate when we drink, it's kind of like, well, why do we like drinking? Well, we like it because when we drink, our brains release endorphins. It's kind of like the chemical we associate with like runner's high, something like that. Also, it's involved with pain management. If you were to break your arm or something like that, you would have endorphins released to kind of help manage the pain. So they're naturally occurring opioids. They're very similar in structure to morphine or oxycodone or something like that, Vicodin, these types of opiates. So when you drink, you have these naturally occurring endorphins, these naturally occurring opioids that are released. And that's what gives you the buzz. That's why drinking is enjoyable. But if you've taken the naltrexone at least 1 hour prior to drinking, the medication blocks these receptors, so that when you drink, you don't get that reward. You don't get the buzz. So what happens is that really just like any other type of behavior, all behaviors that we have, if they're rewarded, you're going to see an increased frequency of those behaviors. It's called operant conditioning, which many people remember from, like a Psych 101 class, something like that. So it's just basic learning, where we drink, we get a reward, we drink, we get a reward. And over time, that association forms a pretty strong network in your brain. But with the Sinclair method, you drink, you don't get the reward. You drink, you don't get the reward. You drink, and so on. You do this over about 4 to 6 months. And then what you see is a pretty predictable, what we call an extinction curve, which is a gradual reduction in drinking. And you start drinking less because you're not getting that reward. And it's really a neurologically based change in your behavior. You're not getting that reward, therefore you're not having thoughts, you're not having compulsions, you're not having cravings, you're not having all these types of things that kind of propel the behavior in the first place.
Well, and it makes sense thinking about it now. And I understand the logic behind it way back when the drug was first approved. If you want people to stop drinking, then they should stop drinking. And that kind of just makes sense that they would suggest, okay, well, don't drink while you're taking this. But when you're dealing with somebody who is used to drinking lots of alcohol, day after day after day, and then you just tell them, okay, well, now all of a sudden just go cold turkey and stop. That's easier said than done. They're not going to be quite as likely to be successful when you ask them to do something like that. And so I can see why the medication wasn't all that effective way back when. But now looking at it this way, yeah, there's that reward that you get. I mean, anyone who's ever had a drink of alcohol ever probably understands what we're talking about. When you get that reward, that you feel, it makes you feel good in a way. Obviously the next morning, if you overdo it, you're not going to feel quite as good.
That's
But
right.
but the immediate effect, you're feeling good, and so like you said, you get that reward and you want more of that reward. So you do it more and more and more and more.
Mhm.
And that leads to the problems that we're talking about
Mhm.
here. And so, yeah, blocking
You know,
that
you know,
reward is just like a logical next step.
That's right. And of course, for any behavior, or really any trait about us, physical or mental, there's always some type of a genetic contribution to it. And what we're learning is that the people who develop a problematic drinking, they really have kind of a hypersensitivity to the exposure to the alcohol. It really does create a kind of an exaggerated release or response in the form of these endorphins. So it really is a rewarding experience. Their kind of brain lights up in excitement in a different way than people who don't develop these problems. And that was one of the kind of things with the original study, when you can, especially like in lab animals, you can really breed, kind of mice who are prone to alcohol dependence. But what's really interesting too is you can breed mice who, no matter how much they drink, they don't develop these behaviors. But one of the things so there are many similarities, even if you say, okay, well, these are lab animals, but ultimately we find that there are lots of similarities because it really, there's an underlying neurology there with the kind of predisposition to the endorphin, kind of the reward of this endorphin release. And then also, kind of when you take away that reward, you see a reduction in the behavior. One of the things I'll tell you too, it's kind of interesting too, when you think about, like, because you were saying, well, of course you would just give this medication and advise them not to drink. One of the things that Alcoholics Anonymous, which is kind of like the go-to standard treatment and really kind of the standard way of thinking about the drinking problems. One of the things that they say that is definitely correct, they say, well, you can be abstinent for 5 years, 10 years, however long, you cannot drink for some extended period of time. But if you start drinking again, you're going to pick up exactly where you left off, which is really a fascinating type of thing, because it kind of reveals that no matter how long, how much time has passed, your brain is essentially the same, that nothing has really changed about the addictive part of the brain in question. 10 years has passed. So it really kind of demonstrates that abstinence is not really a treatment. If you can go 10 years without drinking, and then something fundamental to the problem is completely the same, it really shows you that you really have to actively reverse these associations. That time alone is not going to really have too much effect about the underlying neurological aspect of it.
Now, what about with the Sinclair method? So when you have somebody who, let's say they've been alcohol free or been using the drug to kill that reward that they get from drinking, so maybe not necessarily being alcohol free, just free of that reward.
Mm-hmm.
If they were to, let's say 3, 4, or 5 years from now, after they've kind of kicked through the habit and the ritual of going out and drinking, and for the sake of drinking, getting that reward, if a few years from now, if they were to drink without the medication, is there risk of them relapsing? Obviously, if you do anything in excess, yes, there's going to be that risk. But is it like what you're talking about with the AA, where they say you drink once, you're
Right.
going to be right back to where you were? Is it going to be the same kind of situation, or is it more of a gradual kind of thing?
Yeah. Well, first of all, most of the people that we work with, just like most of people in society, most people in the world really, do continue to drink. Abstinence is not required, and we don't ask people to be abstinent because obviously it's a normal part of our society. When people
Mhm.
want to, even just to fit in or kind of be part of the happy hour after work, people that don't drink, there is often a risk of being socially isolated or in some way kind of being the odd man out or something like that. So most of our people do like to drink in a socially kind of, appropriate way, in a way that they feel comfortable with. So whatever that might be, once a month, once a year, whatever it might be. Most of our, people we work with that do continue to drink, but it's just a very matter of fact way. It's not something that they have to spend too much time kind of regulating. But, you kind of want to think of the naltrexone the way you would a seatbelt as far as the Sinclair method is concerned. You say, okay, well, am I going to have to wear a seatbelt for the rest of my life? Well, you're going to want to wear a seatbelt, every time you're in the car for the rest of your life. That's going to be a smart, safe thing to do. Of course, you don't drive every day, so you don't wear your seatbelt every day. And so that's how naltrexone is for people who, for whatever reason, they have, this kind of wiring that predisposes them to over drinking. It's going to be a really smart idea for them to take the naltrexone prior to drinking. So it's not a daily medicine, but if you drink once a week, you're going to want to take the naltrexone prior to drinking. So it's not something that people would be taking daily, but there is sort of an indefinite aspect to it that you want to take it before drinking. Now, to answer your question about, well, okay, let's say you've reached this point, I kind of call it the point of indifference as far as alcohol is concerned. You can take it or leave it,
Right.
And it's not a big deal. So let's say Dr. Sinclair called it pharmacological extinction, an extinction being that there's no longer an association between this behavior and the reward. So let's say you've reached that point, but for whatever reason, you decide you're going to drink without taking the naltrexone. Therefore, you'll get the buzz, you'll get the endorphins, and it'll be a kind of a rewarding experience. Now, you're not going to be back to where, say, you left off, so to speak, because the association has been extinguished. However, the same kind of underlying predisposition to develop and strengthen those associations will still be there. The kind of the foundation upon which the problem developed is still there. So if you continue to drink without it, those pathways will just be strengthened, and then the person would eventually find themselves back kind of in the same. Now, which is not great. I mean, the person kind of gradually finds himself back in the same kind of situation. But it's definitely better than what happens when you see what typically happens with AA, or kind of in response to, and you use the word relapse. When someone relapses, one of the phenomena that Dr. Sinclair really kind of described really well is what he called the alcohol deprivation effect. And this actually occurs in many types of things, especially like dieting or something like that. But the alcohol deprivation effect is that when you deprive yourself of something, in this case, drinking and getting that buzz for some period of time, the deprivation of it actually increases interest. It actually increases the frequency of thoughts toward that kind of denied reward. And then when you kind of inevitably do relapse and then drink, where you're going to see is kind of a gigantic binge at that point. And people see this with, when they kind of restrict themselves from dieting as well. But you definitely see this with drinking, that people after a dry January or whatever kind of the basis for their abstinent period, when they finally do start drinking again, it's not just kind of where they left off in some ways, and it's often worse. Kind of the relapse is quite large. So that's kind of another kind of piece of the puzzle where abstinence actually increases the preoccupation in your brain's kind of pursuit of it.
Yeah, that's interesting. Now, the question about the drug itself, naltrexone, are there any side effects to it? Because you say, you should take it before going drinking. And if this is going to be a lifelong thing, obviously it's not a daily thing every day for the rest of your life. But, if I was taking any kind of medication, the first thing I'd want to know is, what are the side effects? And do those outweigh the benefits of it?
Yeah, I mean, well, one of I guess kind of a framework to really kind of think about that question is to kind of first kind of think about what are the side effects of the drug of alcohol that that kind of we're also talking about. And of course, that drug, nearly every system in your body increases risk for cancer, increases, of course, hepatitis and cirrhosis, other liver diseases, increases your risk for mood disorders, anxiety disorders, sleep disorders, anything you can think of. I mean, these are potential effects from the alcohol, which of course are, causes opiates to be released. I mean, it's very much a drug. So that's kind of one way, kind of when you're kind of deciding, kind of, weighing all these benefits and risk and those kinds of things, is that the alcohol itself is really, if you think about things that are in a grocery store or really even pharmacies now, alcohol is very toxic. It's a toxic substance. So that's kind of like the thing that we're kind of weighing all of this against. Now, the medication is well tolerated. Most people don't have any side effects at all. But of course, any medication, you're going to have some potential side effects. The most common side effect really is going to be some type of gastrointestinal side effect. So that's going to be nausea, vomiting, diarrhea, something like that. And that's sort of an interesting thing too, because that's really a common side effect for a lot of psychiatric medications, medications in general, but it's specifically interesting in psychiatry because most of the neurotransmitters, the chemicals that we think of as brain chemicals like serotonin and dopamine and norepinephrine, and in this case, opioids, we think of them as brain chemicals, but really about 80% of those chemicals I just mentioned are manufactured in your gastrointestinal system. They're mostly gastrointestinal chemicals, if you want to think of them that way. So because this medication affects opioid receptors, which are mostly in your GI tract, then it makes sense that most of the potential side effects would be nausea, vomiting, diarrhea. It's also interesting too, the drugs that we use for depression, anxiety, those types of things, the most common side effect of those, nausea, vomiting, diarrhea, because of all the serotonin and receptors that we have in our GI tract. So that can be an issue. Usually we have basically food is kind of like a good thing to take with any medicine when you're first starting. So we start people at low doses and then kind of go up from there as tolerated, and then you can have kind of what we would think of as generic type of side effects, would just be like dizziness, dry mouth, sleepiness, something like that. Some interesting things about naltrexone. So, kind of beyond the stomach and beyond kind of like just generic types of things that any medicine might cause. It can actually cause something that some people don't think of as a side effect, but a benefit really. It can cause changes in regards to carbohydrates. So and there's actually a prescription drug on the market that's a combination of naltrexone and another medication used for depression called Wellbutrin. This combination drug is called Contrave, and it's used for obesity and binge eating, overeating, these types of things. So naltrexone is also sometimes used for binge eating because it blocks the opioid system, which is tied into our carbohydrate system, or carbohydrates affect our opioid system. Like sugar is kind of viewed by our brain as a drug. So when you take naltrexone, you're going to have a generalized, or often will have a generalized reduction in your brain's interest in carbohydrates. And of course, alcohol itself is a carbohydrate. So people often, people can take naltrexone for binge eating and other kind of eating disorders as they relate to, especially as they relate to carbohydrates. So people do notice appetite changes, or often notice appetite changes. Of course, as they're drinking less, you're having fewer calories, but there seems to be something on top of that as well that people kind of, they're, to the extent they have a sweet tooth or something like that. And there are some interesting relationships between kind of sweet tooths and alcohol issues as well. Now, there is sometimes some issues I guess a common question people ask is, is like, well, you're blocking these endorphins, and endorphins are, as I mentioned, they're associated with runner's high, sex, chocolate eating, all these kinds of endorphins are used, or kind of our body's way of kind of rewarding us as well for other types of often beneficial behaviors. So people sometimes wonder about that. Well, if you're blocking these receptors, am I going to not enjoy running and sex and chocolate and all these other kind of things? And it's a good question, because it really does make sense that would be the case. And we do sometimes see that. It's not really a common thing though. Usually if we see something in that department, it would not be kind of a complete absence of reward. It would be that the magnitude of the reward is diminished somewhat. So if they ran a marathon, instead of that runner's high being an 8, it would be a 6 or something like that. So
sure.
But again, it goes back to comparing that to alcohol. Of course, alcohol is a depressant and those types of things. So it's always kind of, compared to alcohol, most people are feeling great. Most people feel wonderful that they're drinking less.
Yeah. And that all makes perfect sense. And I actually wonder how many of the side effects that you mentioned, like things like nausea, vomiting, drowsiness, those types of things are, a lot of those you get from drinking alcohol anyways. And if you're drinking the alcohol while you're on that medication, very likely I would think it's not necessarily the medication. It could be from the alcohol itself as well. So, it really, to me, I don't see any of those things as like deal breaker side effects. If this was me evaluating this and looking at the pros and cons, I'd be like, okay, well, yeah, if I'm going to go out drinking, I'm probably going to end up feeling kind of nauseous, maybe to the point where I'm vomiting. I'm definitely going to be drowsy anyways. And so what do I have to lose here? Like, it may just be drinking less, or I won't get to that point where I'm having nausea, vomiting, all that kind of stuff. So,
That's right.
I look at that as in a way, kind of a positive,
Yeah.
because, I'd be having those types of things anyways if I was binge drinking and,
Binge
and
drinking.
that kind of
Yeah,
stuff.
that's right.
Right. So, and
Although
you
even,
also, oh,
yeah, I was going to
go
say,
ahead.
even that's only like 10%. I mean, the vast majority of people don't have any of those side effects, but
Sure.
if they do, it's most likely to be a gastrointestinal.
Yeah, exactly. And so, since it's such a small percentage of the people, and I would imagine it's likely the people who are just first starting to use it, because over time your body gets used to it, and then you're not going to have those kind of side effects quite as often, I would imagine. So, really for me, as I'm doing my mental checklist of, like, pros and cons, weighing the benefits versus the costs or the risks, I don't see any of that as a deal breaker in my book anyways. I mean, everyone obviously has to make their own judgment for themselves, but to
Mhm.
me, I don't see any of that as being a real negative. You also mentioned how it has some other unintended benefits where, people, their appetite is suppressed potentially, and they don't have that same, the highs that they get from, binging on a meal or whatever, eating lots of food. And that was actually going to be my next question, is like, could this possibly be used for other things? Because I know, things like other drugs, whether it's illegal substances or whatever, or, even eating foods, sweet tooth kind of things, those release chemicals in your brain as well. And I would imagine that there has to be some similarities and some crossover between, not just the alcohol use, but some of the other potential vices that people might have as well, right?
That's exactly right. One of the uses for it now, of course, I think as we go forward, we're going to know more and more, and kind of, I think its application will be broader to other behaviors. But one of the things that's kind of well established is its usefulness for gambling disorders. When you gamble and you hit the jackpot, and you have this rush of endorphins and things like that. So people who have gambling disorders, if they take the naltrexone prior to whatever, however they like to gamble, you can see similar kind of reductions in their gambling addiction. And then kind of what you're saying is, I think this basic idea, I think that the eventual success of the Sinclair method, and by the way, if you kind of track the Sinclair method through like Google searches and these types of things, and number of physicians and nurse practitioners who are providing the service, it's growing and growing and growing. And I think this will kind of will change the way we think about this. So yes, one day there will be something that blocks the cannabinoid receptors, and that will help people that develop cannabis use disorders or whatever it might be. But I think the basic idea is that we're going to kind of appreciate the fact that abstinence is really not necessarily, or even often not, the correct way to think about it. That in accord with the basics of operant conditioning, which is just, kind of foundational learning principles in psychology, you have to engage in the behavior without the reward to
Right.
reverse it. So this is just idea that just not, that not having it, I think just kind of freeing ourselves in that way to think about, that the person does not have to be abstinent. In fact, it should not be for this to work.
Yeah, and there are some benefits to drinking alcohol in some cases. I've read some things about, heart disease and stuff like that, when you're talking about, like red wine or something like that could potentially be a benefit. So, completely eliminating altogether may not necessarily make a whole lot of sense, for people. So yeah, I mean, um, this
Yeah.
to me, it just
I
makes the most sense, right?
That's right. Yeah, and really, the studies, some of these health and nutrition studies are often kind of contradictory. It's like, well, one study will say this, that, and the other. So it's hard to kind of say that, drinking alcohol won't necessarily be a helpful thing. For sure, we know that it has not drinking has negative social consequences.
Right.
People really, it's so embedded in our culture, and especially our social rituals, to just meet someone and have a drink. And, it's like, if you're not at that happy hour where some business deal is being discussed, or you're not, and oftentimes it raises defenses in other people. If you're out socializing, I'm not drinking, what's wrong with him, or what's wrong with, or something like that. So it really creates kind of an awkwardness, or it often can. So kind of people really just like the fact that they can take their naltrexone, go out, and they may not even finish their drink, but just like, they're participating in the ritual, the social ritual, and, then they just go home and they don't think about it. So,
Right.
so I definitely can have most people, a lot of the kind of barriers to kind of solving a drinking problem is that it's a social aspect. People don't want to not go out with their friends or what have you.
Right. And when you think about the last few years with the pandemic and so many people were isolated, they were away from larger groups of people for extended periods of time, people want to get back and socialize with people. And like you said, it's just part of our society, part of our culture is drinking. Meeting up with somebody for a drink is a very common thing. Going to a happy hour after work, very common. And if you're avoiding all of those things, you're just increasing that isolation even longer, which I gotta imagine is going to have even more, mental health impacts going forward, right? And not to say that you necessarily need alcohol, but it's just the way that people interact these days. And it in a way it is necessary. And so having this Sinclair method available and being able to use naltrexone to manage this so that you don't get that reward every time you drink. And like you said, you may not even finish your drink because you're not getting that reward every sip you take, so you're just taking part in the ritual as opposed to seeking out that reward.
That's right. And actually, people say that once they kind of reach this extinction phase, they actually the ritual of drinking, they enjoy it more in some ways. Of course, they're not getting the chemical reinforcement, but a person who overdrinks, there's a certain anxiety there because you are worried about overdrinking. You are worried about binging and maybe embarrassing yourself in some way, probably for good reason based on history, So people they develop a confidence in their drinking that they are going to stop when it's appropriate to stop. So in some sense, there's a certain ease that develops around the drinking because they feel confident. They just know they may not even finish the first one, but if it's a concert, maybe they'll have a couple or whatever it is, but it's not going to be excessive, And we always just say too that, drinking is not a problem. Problem drinking is a problem. So people use the Sinclair method just to move from problem drinking to drinking, and they're doing it socially, and they're doing it in a way that they are comfortable with. And and so we don't really have ideas about how people should do that, other than we just want people to have control, and they can use that control to be abstinent, which most people aren't. Most people aren't pursuing that, but then, or they can use it to drink once a week or whatever. But just that it just becomes kind of a non-issue in their life.
Right. And you brought up a point that I don't think we touched on yet, but it's something I think it's important for the listeners to understand, is that while this drug does block that buzz, that high feeling that you might get, the good feeling that you get from drinking, it doesn't prevent you from getting drunk. So it is still possible for you to overdrink and not be safe to drive a car, for example, or whatever, right?
That's right. And that's what's really interesting, kind of alcohol, we kind of think of it as just kind of this uniform chemical or something like that. But really alcohol in and of itself is a cocktail, that it has many effects on our brain and our motor system and all kinds of things. So what's interesting for users of naltrexone is that the medication only blocks the endorphins. It only blocks the buzz aspect of it. It's not an alcohol blocker. And that really actually is important for kind of the mechanism, because you're still getting these other effects. You could still get a DUI, your blood alcohol level is going to be the same. All the impairments that come when you drink, slurred speech, loss of balance, putting your foot in your mouth, all these kinds of things are still going to be there. So you're impaired. You might not be you're not intoxicated, but you're impaired. But it's really interesting because people find that being impaired is not all that great without the buzz on top of it. So you just can't speak clearly or something like that. So
Right.
It's interesting. So all the things that can go wrong when you drink alcohol can still occur even though you've taken the naltrexone. So that's definitely something we encourage. It's like you still need to be a responsible drinker.
Right. And the reason why I wanted to just put that out there is because up until that point in conversation, someone might be sitting there thinking to themselves, wow, this is great. I can go out and drink as much as I want and I'm not going to get drunk. But that's not true. Don't do that, because you're going to get yourself in trouble or hurt somebody else. And that's definitely not what we want to have happen with this. So
that's right.
I think that's an important point. Yeah,
that's right. And it's really an interesting kind of way you put that, because what people find is that even if a part of their brain that seemed like a good idea, like I can drink as much as I want. I mean, that's obviously in a kind of an addictive part of their brain.
Mhm.
what they would find is that because they aren't getting that reward, they would just kind of quickly lose interest in it. That it would be because the brain was not lighting up in this exciting way, they would actually find that they would kind of lose steam, that there would be kind of no point to it, and they would simply get tired because all the other effects of alcohol would be there, like the depressant
Right.
effect and all these other types of things. Most of the time, instead of kind of crossing some line and there's loss of control. If you've taken the naltrexone, what we hear is that people just get sleepy. They just get tired. It's kind of like it is a depressant. So that depressant effect is more pronounced. So yeah, but it is interesting. There's definitely, you kind of described it well. I mean, there's one part of that addictive brain that just, there's no limit to it. The idea of just kind of being able to drink without limit, that would definitely appeal to that part of the person's brain.
Yeah, exactly. And I think that's why I wanted to just emphasize that point, that that's not what this is designed for, and not to, overdo things. Still, you still have to be careful with that type of thing. So for the listeners who are out there who are hearing this and saying, what, I want to give this a try. I want to see how this works. Where can people go to find out more and potentially even book an appointment with you or somebody on your team?
Yeah, sinclairmethod.org. .org is our website. And it's interesting, the laws of medical practice are by state. And this is why I have so many state licenses and the other providers have so many state licenses, because it really depends on where the patient is. So, I can be in Australia, but if I'm licensed in Washington, then the patient has to be in Washington. Or if I'm licensed in Idaho, the patient needs to be in Idaho, or vice versa. So it's kind of, there's, as great as telehealth is, there's still kind of these restrictions on where the patient can be. And so we're licensed in about 35, and that covers about 80% of the population. We're definitely licensed in all the large states, Texas, Florida, New York, California, those places. And, we have a team of psychiatrists, nurse practitioners. All of us have backgrounds in addiction, generally speaking. And then of course, specifically here, all we really focus on is the Sinclair method. So it's easy. It's all telehealth. Go there, pick your state. If you're in Ohio, you pick Ohio on the map, you book your appointment, you see your provider by video. We send the prescription digitally directly to whatever pharmacy you want. And then, of course, we'll have instructions for the medicine, but you take like a half tablet for a few days and those types of things. And you come back, and, the basic idea is that a given quantity is going to last a person longer and longer. Often I would say the most typical person we see is drinking every day. They're drinking a bottle of wine, 2 bottles of wine, had, a case of beer, these kind of things, really, heavy daily drinkers. And so for the first month, they're going to be drinking every day still, but instead of drinking 24 beers, we'll say, we estimate about 25% reduction, the first month. So, it's like they could come back and they're down to 18, which is still, really a lot of beer per day. So 18. And the next day, next time we see them, they're down. And so it kind of works like that over about 4 to 6 months. You're just going to see kind of steady reductions. Some people faster, some people a little bit slower, but that's basically how it works. And then at some point, a quantity of 30 tablets might last you a month at the beginning. Within a quantity of 30 at some point might last you a whole year, depending on what your goals are. It might last you your whole life if you never want to drink again, which is great. So it's very simple, no detox. One of the great things that is the fact that you don't have to detox. It's because it's a gradual reduction in your drinking. So you just drink less and less and less. So it's very safe on that front. I mean, there should not, in fact, we encourage people, if you're drinking heavily, please do not stop abruptly, because there is a risk of seizures and even just your own physical discomfort. So, but that's basically how it works. It's all by video, and you can even have your meds delivered to you, that kind of thing. So it's very private, very convenient. And even if you travel, if you're in Ohio and then you go to California, we have a provider in most states as well. So even people who are out and about, we have ways to kind of continuity and treatment in that regard as well.
Well, that's great. And I think that's, again, going back to the point in the beginning of this conversation about how far we've come as far as telehealth goes, because, who wants to take time off of work to go to an appointment and sit in an office and meet with somebody and then have to explain why you're taking time off of work. And, that's could be rather embarrassing for some people who are in that situation. So having this available where you can close your office door potentially, or, maybe even just go out to your car and have the appointment there, someplace
That's
where it's a
right.
little more private, right?
I've had many appointments in a car. I've had people at the bottom of ski slopes where they just took off, or, you can see the thing in the background. People, I mean, it's just kind of like, wherever you are, as long as you feel comfortable, in terms of, who might see, it's like, I'm happy to see. The only thing is if they're driving the car, of course, if they're driving, I'll ask people to pull over because I don't, it's
Sure.
like you see the trees zooming by, but otherwise, yeah, wherever I've had people, all kinds of places, just because it's a very casual thing. And most of the time it's good news. It's like a really exciting, happy type of mental health practice. For prior to doing the working with the Sinclair Method, I was actually trained at Vanderbilt in their addiction institute, Vanderbilt Institute for the Treatment of Addiction. So that was kind of like my original kind of a specialty. But addiction is generally thought of as a really kind of outcomes aren't great. A lot of the treatments, it's kind of this chronically relapsing type of thing. So it can often be just kind of stats are not great. But now, the Sinclair Method is really such an amazing treatment. It really is, in terms of kind of effectiveness. I think of it as being more effective than just kind of common treatments for like depression and these other things. So it's not just gone from kind of the lowest kind of successful outcomes of the issues I was helping people with. It's actually become the most commonly, most common successful treatment. It really is amazing, for people to really be liberated from this. One of the things with drinking, if you develop a drinking problem and you do some type of abstinence program, almost all of the metrics that a scientific study would use would just be how long did the person maintain their sobriety. They went 6 months, or whatever the measurement was. The chief concern of the study is how long did the person go without drinking. But it really doesn't talk about how many times did they have to fend off a craving? How much mental energy was expended kind of, fighting this battle in their brain? How much time did they spend at a meeting? How much time, these types of things. So it doesn't really tell you, it doesn't really kind of capture the aspect that you're kind of a prisoner to this in some way, to this, your brain really is not going to let you go. It's not going to let this issue go. It's going to keep kind of pursuing this reward. So what we really hear and see is just this, it really is a liberation that yes, the people are not drinking, or maybe they're drinking, in a casual way. But what they're free from is this incessant kind of monitoring and regulating. Am I drinking enough? Or I'm only going to drink on Monday, Tuesday, when, it's like this rule making around, it's like the whole issue there from it. So I think that's what's really great about it, is that people are just kind of, the alcohol problem, the alcohol solution, none of it is occupying the person. I mean, they truly are free from it, from the issue.
Well, that is great. And I think it's a great news actually for some of the listeners who might be out there who are struggling with this, or maybe know somebody who is struggling and they've tried a whole bunch of different things. They've tried AA, they've tried other things, and they just don't seem to be sticking with them. As far as I'm concerned, just it's one more option out there that gives hope to the people who are struggling, don't know what else to do, where else to turn. So again, the website is sinclairmethod.org, and I will have a link to that in the show notes for listeners who are interested in finding out more about the Sinclair Method and where they can book an appointment. You can do that all on their website. Brian, it's been a pleasure speaking with you and learning more about the Sinclair Method and how it works. Not just beating this, but being able to live with it and not feel like you're isolated from other groups that may still be involved in drinking alcohol and things like that. So thank you for taking the time to come on and share this with us.
Oh yeah, it's my pleasure. I mean, it's such a really alcohol. Of course, the opioid epidemic is a big issue, but really in terms of financial cost to society, in terms of health costs, mortality, all those things, alcohol, really, it's an alcohol epidemic. It exceeds the societal cost of the opioid epidemic. So it's a really big problem, and this is really an amazing solution. And I hope if your listener specifically doesn't have a drinking problem, almost certainly they know someone who does. I mean, it's really that widespread. So it's my pleasure to share it with you, and hopefully, someone will check it out.
Thanks for listening to the Drive On Podcast. If you want to support the show, please check out Scott's book, Surviving Son, on Amazon. All of the sales from that book go directly back into this podcast and work to help veterans in need. You can also follow the Drive On Podcast on Instagram, Facebook, Twitter, LinkedIn, YouTube, and wherever you listen to podcasts.